Hello everyone, I'm Dr. YouTube. I'm not a doctor, I just play one on YouTube. You see, the thing about doctors out there in the real world is they're often a bunch of egotistical, narcissistic prima donnas. That is why I'm here. I'm here to bring you some good quality medical information from someone who is not a vain, egotistical prima donna. Is my hair looking all... Would someone bring me a glass of water? It's bloody hot in here. Anyway, today I received a message from a Mathis Marks Ilgen, whose 32-year-old daughter is struggling to come off with a prescription tranquilizer, Lorazepam. Lorazepam is a medication of the benzodiazepine class. The benzodiazepines were originally synthesized in the late 1950s and soon became blockbuster drugs. I'm sure you have all heard the term mother's little helper, which referred to Valium, which at one point was the #1 prescribed drug in the entire world. Imagine that. Anyway, I do not believe it would be advisable to try and discontinue the use of lorazepam by tapering down with lorazepam. The reason for this is that lorazepam is a rather high-potency benzodiazepine with a very brief half-life. Heather Ashton ran a very successful benzodiazepine detox clinic in Great Britain for a number of years. You may Google Heather Ashton, Ashton, and locate the Ashton Manual online, which will give you and your daughter the power of information necessary to successfully discontinue this drug. The Ashton Manual suggests that you do not use the benzodiazepine you are already taking in order to taper off, unless you are already taking a low-potency benzodiazepine with a long half-life such as Librium or Valium. Heather Ashton suggests the use of Valium. The generic name for Valium is diazepam, and its active metabolites have a half-life of up to over 400 hours. It's also rather low potency and easy to work with. It comes in 2, 5, and 10 milligram tablets that can be divided into fours. In this way, your daughter should be able to taper her use of benzodiazepines very gradually and experience the minimal amount of discomfort. Anyway, Mathis Marks Ilgen, I sincerely hope this answers your question. If anyone has any further questions for me, you may post them here on YouTube, and I would be glad to answer them on video. Thank you ever so much to everyone who has watched this. Anyway, I'm a very busy internet pretend doctor, and I have lots of important things to take care of, so I simply have to go. But it has been wonderful